Did you know that with some Medicare plans, you would only spend $329 on prescription drug costs for the whole year, regardless of how expensive your medications are? That's right, thanks to Medicare's enhanced Medicare Part D plans for 2025, some plans give you very low out-of-pocket costs for the entire year. Even if you have very expensive drugs that cost $1,000 a month, an enhanced Medicare Part D plan allows you to get these meds for a fraction of the cost. Now, in this video, I'm going to show you how the math works and then show you how to enroll in one of these plans. So let's find out. If you've been watching the news, you know that there were some major changes to Medicare Part D in 2025. The first is the infamous donut hole finally went away. I won't explain in depth here, but the donut hole was a payment stage where you had to pay a lot out of pocket for your prescription drugs, and it's been getting better and better over the years. But don't worry, it is now gone. Now, the second big change in 2025 is that the maximum out-of-pocket limit was changed to $2,000, and that was significantly lower than it was before. This means that once you spend $2,000 out of pocket for your prescription drugs, then the plan's going to take over and you don't have to pay anything else for the rest of the year. But some people are actually paying a lot less than $2,000, and I'm going to show you how. In 2025, there are two types of Medicare Part D plans. There's basic and enhanced plans. Basic plans are straightforward. Medicare says your maximum out of pocket is $2,000. So with the basic plan, you have to spend $2,000 out of pocket before your plan takes over. An enhanced plan is where the funky math comes in. It's because even though Medicare says that your maximum out of pocket is $2,000, some people only spend $329 before their enhanced plan takes over and they're done paying for the rest of the year. This is because enhanced plans count a number called the true out-of-pocket costs, or TROOP, T-R-O-O-P, and your true out-of-pocket cost is different from what you actually spend, which is crazy because you hear true out-of-pocket cost, you think, oh, that's got to be the true amount that I'm going to spend. Well, true out-of-pocket cost includes other things, not just what you spend, the check that you write, the card that you swipe at the pharmacy. It includes more than that. So the true out-of-pocket cost, once it reaches $2,000, you're done paying. Well, this sounds really complicated, right? Well, I'm sorry to tell you, this is just how Medicare is. It's how the government does things. There's rules, and then there's exceptions to rules, and there's things that say they're true and they end up being false, right? Like the true out-of-pocket. Well, it's not exactly your true out-of-pocket. This is just how it is. But there are people, like I said, who are only spending $329 on drugs and hitting their maximum out of pocket. So let me explain how this works. So first, at the start of every year, you'll find yourself in the deductible phase. During this stage, you pay 100% of the cost of your drugs until you meet your deductible. Once you reach the deductible, then your plan will kick in and start helping you pay for your drugs. Medicare Part D plans are free to set their own deductibles, but the maximum deductible that they can have is $590. So let's say that your plan sets a deductible at $200. Then you would need to spend $200 out of pocket before you move into the next stage. Also, that $200 will count towards your maximum out of pocket. So in this case, you've spent $200. That means that you have $1,800 left to spend before you're done paying for prescriptions for the year when you're on the basic plan. But here's the important part. When it comes to enhanced plans, they always count the $590 towards your true out of pocket, or your TROOP, even if the plan has a $0 deductible. So the $590 always counts to your true out of pocket. So if your plan has a $200 deductible, you still have to pay that $200 out of pocket before you move to the next stage. However, in the background, your enhanced plan is already counting $590 towards your true out of pocket, even though you only paid $200 of it. So this is how you can get rid of paying the full $2,000 that you'd normally have to pay. You choose a plan that's enhanced and has a lower deductible is the first step in that. If it has a lower deductible than $590, your maximum out of pocket for yourself is less than $2,000 now. Okay, I'll show you some examples in action in a bit, but stay with me for a minute because we need to first look at the initial coverage stage, which is actually the second stage of drug coverage, because during the second stage, Part D plans start helping you pay for drugs. They usually divide the drugs that they cover into tiers, which they have co-pays for. So here's an example from a real plan. This plan has a 4-tier formulary. A formulary is a list of drugs, and the tiers are 1, preferred generic, 2, non-preferred generic, 3, preferred brand name, and 4, non-preferred brand name. This is a very typical tier structure. Tiers 1 and 2 are usually generic, and they don't cost a lot, while tiers 3 and 4 are more expensive. They're usually the brand name drugs, and they will cost more. With a basic plan, the exact amount that you spend out of pocket is what's going to count towards your $2,000 maximum out of pocket, because they will charge you a percentage, and the percentage for 2025 is 25%. They will charge you 25% of the cost of a drug. So if a drug is $100, you have to pay $25. That full $25 $25 will count towards your maximum out-of-pocket. If the drug is $1,000, you will spend $250, and the full $250 will count towards your maximum out-of-pocket. So once you reach $2,000, then you're done paying for the rest of the year, and that's how a basic plan works. But with an enhanced plan, the 25% always counts towards your maximum out-of-pocket, even if you don't pay it. So in the example of a $1,000 medication, your copay is $250 on a basic plan. On an enhanced plan, maybe it's only $50. Well, the full $250 counts towards your maximum out-of-pocket, even though you only paid $50 of it. The $200 in the enhanced plan that the plan paid on your behalf still counts toward your $2,000 maximum out-of-pocket. Because of this, you can actually find Part D plans where you only have to pay $329 total for the year to hit your maximum out-of-pocket. Let me show you an example of one of these plans. This is a Medicare Advantage plan with a built-in prescription drug plan, or MAPD as we like to call it, Medicare Advantage Prescription Drug Plan. It has a $0 deductible, and the plan has a $47 copay for Tier 3 drugs that even if the retail price is $1,000. In January, because the plan has no deductible, all you need to pay is the $47 copay. However, because it's an enhanced plan, the $590 Medicare standard deductible has counted toward your true out-of-pocket cost. Not only that, the 25% of the remaining $410 also counted towards your true out-of-pocket. So in January, the total amount that counts towards your maximum out-of-pocket is $693. Now from February to June, things are a bit more simple. You continue to pay $47 a month each time that you get your prescription refilled, but your enhanced plan is counting 25% of the retail cost of the drug towards your true out-of-pocket cost. 25% of $1,000 every month is $250 that's being counted towards your troop. Now when July comes, you pay the same, the $47 copay. But with this, your troop has reached officially $2,000. And you're done paying for the rest of the year. So from August to December, you won't have to make any copays anymore. And if you add up all the out-of-pocket costs that you have spent for these refills, you find that it's $329. You spend $329 to reach a $2,000 true out-of-pocket cost, which is not actually true. It's a combined out-of-pocket cost, even though it's called the true out-of-pocket cost, combined out-of-pocket cost between what you spent and what the insurance company spent versus a basic plan. So does this all sound too good to be true? Well, it's time for me to spoil the party a bit and tell you some considerations that you need to know about this. Number one, plan premiums don't count towards your $2,000 maximum out-of-pocket. So if you have a $50 premium or a $100 premium or a $0 premium, it doesn't matter. None of that counts towards the $2,000 you're going to spend in the year. Generally speaking, the enhanced plans are available with Medicare Advantage plans. There are very few enhanced plans that are standalone prescription drug plans or PDP plans. So if you have a Medicare supplement plan, you will have a hard time finding an enhanced standalone prescription drug plan without paying a much higher premium. Number two, only the drugs in your plan's formulary count towards the $2,000 maximum out-of-pocket. Part D plans do not cover all drugs. Instead, they're free to decide which drugs they cover and which ones they don't, as long as they always have 2 drugs in each therapeutic category. So they have to cover every category. It's not like they can just say, we're not going to have drugs for people with diabetes. No, they have to cover drugs in every category, but they can decide which ones they cover and which ones they don't. So if there's prescriptions that you take, we need to look at those and figure out which plans cover those prescriptions and make sure that those prescriptions or those drugs are in the plan's formulary before you enroll. Because if you buy prescription drugs out of pocket with cash, or you go to Costco or Sam's Club or something and say, I'll just do a cash discount, or I'll use a discount card, or whatever you do, that will not count towards your $2,000 maximum out of pocket. It has to be a drug that's covered by your plan. Number 3, enhanced plans are not as effective with low-cost drugs. If you have a low-cost drug, you're not going to hit that maximum out of pocket because the costs are so low. So in the example of a $1,000 retail drug that you're only paying $45 for, $250 is counting towards your maximum out of pocket. But if the drug is only $100, then only $25 is counting towards your maximum out of pocket. You see, so with a low-cost medication, you're probably not going to hit that ceiling. Number 4, enhanced plans are less effective when they have coinsurance instead of copays. Again, in the example I showed you, a $47 copay for a Tier 3 drug, many people have a 25% coinsurance instead of a fixed copay. So if you have a coinsurance, then you're probably paying more of that true out-of-pocket cost, and you're not going to have the enhancements of an enhanced plan like I showed you. In that case, your true out-of-pocket cost will more closely mirror what you have actually spent. Number 5, finding the right enhanced plan and comparing all of the actual numbers is difficult. I actually made a complete tutorial on how to find a Part D plan by yourself, and you can check that out. However, if you'd like someone to do the digging for you and to find the absolute lowest cost drug plan, I highly recommend working with a licensed insurance agent. You can call the number that's on your screen right now if you'd like us to help you, but you don't have to work with us. Just look for someone who can crunch the numbers and is going to be unbiased and show you all of your options, because even though Part D is super complicated, you can save thousands of dollars if you choose the right plan, and you need to make sure that you choose the right plan every year because they change every year. Now, if you'd like to learn more about how you can save money on Medicare, then check out this video right here.